Good afternoon, good evening to you all. Welcome to the Future Skills and Digital Health webinar. I hope we are going to have a very fruitful and interesting discussion in the next 2 hours. I would like to invite all the participants in the webinar to use the questions and answers feature that is on the bottom of your screen. This will be open throughout all the seminar, and we can then select some of the questions for the moments that we will open for the discussion. So please use it as much as you would like, and we will use this feature to interact with you. We have now, first of all, some opening remarks with the participation of the Vice Rector for Internationalization of the ISCTE, University Institute of Lisbon, Professor Maria das Dores Guerreiro, and with Oscar Dias, the Project Officer at the European Executive Agency for Digital Health. I would like to thank you all for being here and for your interest on participating in this webinar. And I would like to pass the floor right away to Professor Maria das Dores for her opening remarks. Thank you so much.
Thank you. Good afternoon to all the participants in this webinar of the ManagiDiTH project, an European funded project through the Digital Europe program. And first of all, word of thanks goes to Oscar Dias, as Carmo says, is with us from IDEA, and he will be sharing this opening session with me. The project that gathered us here today is developed by, as most of you know, a consortium of 4 universities. Are you seeing to me? Are you listening? I guess
now we can see you. Now we can see you.
Sorry.
Yes.
As I was saying, this project is developed by the consortium of 4 universities led by ISCTE, involving also Laurea from Finland, Thessaloniki University from Greece, and the University Gustave Eiffel from France, as well as a set of partners from research and private sector. With this program, we are modestly contributing to the aim within the EU goals of creating 20 million ICT specialized jobs in the European Union. And in particular, we are working in a sector, the healthcare sector, where the challenges and the skills shortages faced by many countries are significant and need to be addressed quickly. It is expected that 480 master graduates will be trained through this master, and half of them being women. This is a very important objective. This project is of a strategic importance to ISCTE's internationalization objectives, and I am very keen on this issue. But I know that the same is for the other partner universities, as it mainly aims to design and develop a joint master's program to be delivered to the potential students from all the European countries. The project also contributes to the strategic objective of ISCTE and the other partners to advance in their digitalization of education programs, as this is going to be a program delivered mostly online and by an international group of teachers responsible for each of the units, using innovative tools and platforms, teaching learning methods, and assessment techniques. So this event is mainly to introduce you what our project is about, where we are in the preparation for opening this master program already next September 2024. Where you can get in this master, in this site master, more information about application procedures. Our website is launched today also. For sure you will have it in the screen later on, but you also want to take this opportunity to share with you a first research product that we are publicly releasing today, the Skills Needs Forecasting on Digital Health Ecosystems report and its main findings, which were the basis for the development of this joint study program. So the session 1 will be only about this study and its findings. On another hand, I would like also to stress that while working in true partnership spirit since the very beginning of this year, the project team has been able to accomplish a set of important milestones, and Carmo Gomes will speak later on in detail about all these results. Though introducing our project activities and first results is very important, we also thought that this launching event would be the right moment to resume the public debates about AI and the future of the healthcare services. This will be the topic of our panel that brings together well-known specialists from the digital health field, moderated by a CEO of a digital services company provider. And I would like also to thank them for their interest to discuss with us their ideas. So many thanks to you all on behalf of ISCTE and on behalf of the project. Therefore, this panel will be about how AI is changing our lives and how this will change the way we access to and make use of health services we are diagnosed or treated in the healthcare sector. So I believe exciting ideas will be brought to this discussion. And just the last word to say that more will be done in the next months and years. And we are very confident that this partnership can only be reinforced and enlarged to other partners through a stronger involvement of our associated partners of the project, but also of any other partner from the digital health ecosystem that would like to join us in this adventurous challenge. So we hope that you will feel encouraged to contact us in the near future and to enlarge our network throughout the implementation of our project. Thank you very much. And now I pass the floor to Oscar. Oscar Diaz, please.
Good afternoon, everybody. The dear professor, dear Carmo, dear consortium members, dear all, many thanks for, having invited me to this important launching event. I feel very honored to be part of that. I will be very short with my opening remarks, but first of all, after those thanks, I would like to remind you all that 2023, it's a very important year here in the European Union, as you know, because it was designated by the European Commission the European Year of Skills. So this is very important because your project, your joint master, it's gonna play a very important role in this initiative, especially as you have already mentioned, for the upskilling and reskilling of workers and students to address the significant labor shortages and support the transformation or the digital transformation of key sectors that the healthcare system. Nowadays, we concluded here, based on various studies that that more than 90% of the professionals will need digital knowledge to get a good job, to be, current and ready to hit a job. And it seems that at least 42% of the union citizens are not yet there. So, those masters, they play a crucial role, and we feel very proud to contribute to their funding. Then picking up on some of the ideas that have been highlighted by Professor Guerreiro, I would like also to highlight the importance of these kind of masters to prepare workers, students, to work in a more resilient, secure, and trustworthy infrastructures, and to raise awareness that all those technologies like AI are indispensable nowadays, as you show us in the healthcare system, but they might respect the European rules and values. So it's very important that I would like to take this opportunity to refer to the words of the President von der Leyen a few days ago during the State of the Union speeches, where she mentioned that artificial intelligence should develop a more should be developed in a more human-centric, transparent and responsible way. So the European Commission is working from a regulatory side on all those aspects, but we also count on the masters that we are funding to take into consideration this AI governance and regulatory environment to adequately promote this trustworthy artificial intelligence. And then for the rest, I subscribe what Mrs. Guerreiro has already mentioned about the digital decade targets and the important role in this regard that your project may play, because I feel honored to be the project officer of a project that has the ambition to certify and train such a big number of students per year, and last but not least, to agree to certify at least that 50% of those graduates to be female. So without further ado, I give you back the floor, and I thank you again for giving me the opportunity to be present in this event. Thank you.
Thank you so much to both Professor Maria das Dores Guerreiro and Mr. Oscar Dias for such interesting ideas that are just being brought at this very, very first moment of our webinar. It's now the moment for me to say a couple of words about the project that I'm also honored to be the executive director. I'm just the captain of a large team, and with all my modesty, I want also to thank all the very good work that we have done so far in this very good partnership spirit among the 8 partners that form the consortium that has applied and has won this project proposal. Throughout this webinar, we are going to have the opportunity, as it was said, to have these 2 different sessions. One that will present one of our first results, our first product, that is a research product. The research was conducted in the 4 countries that are going to implement the master program, and it's about forecasting the skills that are needed on digital health ecosystem. And then a second moment where we will have this panel moderated to discuss one of the most important and burning topics of our daily lives, that is how we are going to be impacted or how our lives will change due to the emergency of these AI tools and of all the information that is now being produced and created through these new technologies. I think very interesting ideas will pop up during the debate. I would like to remind you as well that there is this Q&A feature. So for the ones that have not been in the beginning, and you can at any time pose your question on the Q&A, and we will then select some of them for the interaction during the discussion periods, both in session 1 and in the panel. The project managing the digital transformation in the health sector, that has this, I would say, funny acronym, but very difficult to pronunciate, that is ManagiDiTH, is all about and is mainly focused on creating this master program. But it's not only about that. The project has 8 work package, and Paulina, next slide, please. Yes, thank you. As 8 work package, so 8 building blocks that are under the responsibility of the different consortium partners. And of course, that you can see in this green light zone, the focus of our project, that it's all about the conception, the formulation, and the design of the master curriculum for the master program implementation, but also its implementations arrangements. And as this is a program that will be delivered jointly in an integrated manner by the 4 universities, we have to come to an agreement between the 4 universities on how this program is going to be implemented. Also, and let me use this word, jungling a little bit with the different rules that apply for the different EU member states for accreditation, for instance, or for admission criteria. And this has been quite a challenging discussion, but we are step by step getting into the consensus and finding the right solutions, which I hope that can also serve as an inspiration for the 4 of us, for sure, the 4 universities, but also other universities that will have to implement or would be willing to implement this type of joint integrated master programs in the future. Besides the focus on the master program design and implementation, the project also foresees a specific interaction with the research and the health industry sectors. So we have a work package only dedicated to that, to learn lessons from research on what we have been doing and implementing throughout the master, but also fostering this logic of partnership with the private sector. And today, having also the representatives of the private sector as the moderator of our panel later on, I think it's a very good signal that we want to strengthen this cooperation between the public institutions, of course, the universities and higher education and research institutions, but also the private sector companies that are developing these digital transformation processes in the healthcare services and sector. What I would like to say lastly, because I don't want to take much of your time, is about the project. So what is about the program, about the master program, sorry, what is really new about this master? When I have to speak about this master, I always say that this is not going to be yet another master. This is going to be a master for supporting the digital transformation in the health sector by integrating 3 different scientific fields. There are other masters that are, of course, targeting the digital transformation processes. And there are masters and postgraduate training programs that are also focusing on digital transformation process in the health sector. But what is new in our master is that we are bringing together these 3 main areas of skills and knowledge by bringing together the 4 universities that have also quite a specialized perspective on this. So we are bringing together, first of all, a component on digital skills. All the technologies that are supporting the digital transformation process are going to be addressed through the curricular units that are within this digital skills component, but we are bringing them, embedding them together with the social skills that are needed to understand, for instance, the relations between patient and doctors, between hierarchies inside the different organizations, being that hospitals or primary care services, and also, thirdly, the health skills. So there are also knowledge and skills to be developed about how the health services are organized, how the health systems are organized. And being an European master, we are also bringing this European dimension of how the European health area can be further developed, and how the integration of these different health systems in the different countries with different logics and different models are being developed. So this idea of bringing together the three main components of digital, health, and social skills and make the interaction between them is one of the uniqueness of our master program. So I really would like to close my presentation of the project, not by telling you everything about what is the project about, but by stressing these two very important topics, that the master program that we are developing will not be only yet another master, and we are all very much committed to bring some innovation through the integration of the different scientific fields by adopting a transdisciplinary approach, not an interdisciplinary approach, but a transdisciplinary approach, and by delivering it in an integrated manner. So maybe many of you are already familiar with the way that Erasmus Mundus, for instance, are organized, which are mostly about mobility of students. And this is not the case of our master. Our master will be delivered only online, which is also another challenge. And each curricular unit will be delivered by a group of 4 teachers, one from each university, that will produce the contents together and will deliver the master program together, which I think it will be also a very interesting opportunity for the teachers and the students that will be involved in this implementation to also learn about different socio-cultural backgrounds and the different institutional backgrounds that each of us belongs to. Professor Maria das Dores Guerreiro said that I would say something about the results that have been achieved so far. And in fact, during these first 6 months of the project is just running from 6 months now, I would like to say that we have been able to accomplish very important milestones. One of them is, of course, this event that is running today, together with the package of communication and visibility materials and tools that we have just launched, our website, our social media networks, and you will be informed about it. But on the content side, we have been able to design the curriculum together. We have been able to submit the accreditation process in both Portugal and Finland, and now it will be the turn for Greece and France, because also calendars differ. We have been able to complete this skills need forecasting report that is the basis for developing the curriculum. We have been also designing an innovative digi-pedagogical strategy that will be modeling the way that the online teaching and learning process will be developed in our master. We have been also working on this ecosystem mapping, and we are also in the way to develop the platforms that we will use for both the administration of the program and for the delivering of the master program in this online modality. So just to give you a few examples, we have been busy, but the most important of all is that we are very happy that we can contribute to this upskilling and reskilling of some of the target beneficiaries of our project that are mainly professionals from the health and the digital sectors, as well as students from these background areas that could then be the ICT specialized workers that the European Union so much needs. That's all from my side now. I hope that we will have more opportunities to share the progress and the lessons learned during the next years. For now, and for the sake of this workshop and also for keeping the time, I would like to pass the floor and to somehow pass to the session, the following session, pass the floor to Professor Henrique Martins, that is a professor at ISCTE and also the former president of the public institution that was responsible for the digitalization of the national health systems institutions in Portugal. Henrique, maybe you have some more things to say about yourself. The floor is yours. Thank you so much.
Thank you so much, Carmo. I don't want to talk about myself too long. Enough to greet everyone. Thank you for the opportunity to help facilitate the next session, where we are going to hear about the preliminary results of the report on skills needs analysis by Janet Smithson, and this is very important, and this is why I'll present myself. So at our digital agency in Portugal, I had the opportunity of being the only doctor in the beginning when I was appointed, and when I looked around, I had about 400 growth up to 500 IT staff, and the reality is I had the opportunity of having some skills training in digital through my life, not in my medical school, not in my residency program, but elsewhere. And the reason I'm saying this is not because of me, it's because definitely doctors, nurses, pharmacists, managers, all those working in the health sector are now digital professionals. So having had that experience, and having rolled out different digital projects in Portugal and in the European Union, I'm very happy to continue to do some of that work through ISCTE. You can follow other initiatives ISCTE is doing in the cross-border digital transformation of Europe. And one of the things we've all found is the importance of digital skills, because if our healthcare workforce is not ready, we may invest in interoperability, we may invest in digital transformation, but at the end of the day, if the professionals don't feel secure, they don't trust the systems, they don't feel capable, they will retract, they will fear, they will even avoid the technology, and even worse, they will not prescribe digital solutions to their patients, which is the most important trend right now to be discussed. But anyway, this is just to give Janet some time to turn on her camera, invite her to speak. If we can move to my next slide, so I can have the opportunity to quickly present Janet. She is now principal researcher at ISCTE in Lisbon, Portugal, working in this wonderful project. She is also a senior lecturer and research director on 3 doctoral programs in the School of Psychology, University of Exeter, the UK, and her research interests include design and evaluation of digital interaction in health, social and social legal fields, qualitative, cross-cultural and cross-national research methodologies, and research in equality, diversity, and social justice. I think we are in good hands to know about the results of of one of the most important deliverables, according to me, which is to really design this education according to needs. So over to you, Janet, for covering this topic. I will be collecting ideas from your presentation, but also I would like everyone to put your questions to us over the chat function, so that when we have a little bit of time, and I think we will have time for some questions, we'll have the opportunity to tease them out from the chat room and ask them to Janet. Over to you, Janet.
Hi, good afternoon, everyone. So, as already said, we're part of the Digital Europe programme, and on the first page of the Digital Europe website, it says how to make Europe greener and more digital are the twin challenges for our generation. So that's what we're all about, especially the first part of those, but bearing in the digital part, but bearing in mind the green aspect as well. So as Maria's already said, there's 20 million jobs proposed to be created to digital skills across Europe. And our project is contributing to how these skills are created, how people are skilled up to get these new jobs. So as Carmo said, we're trying to develop a master's program to facilitate specialized digital skills for the health sector. And at the moment, we're busy co-creating this through an intercultural, international collaboration of lecturers and sector experts. So the first thing we were doing before setting up our modules, our course design, our curricular unities, we wanted to do a skills need forecasting exercise. So this was a piece of research conducted to ensure that our program isn't just following old expectations, that it's really state of the art, trying to meet the current and anticipated needs in the digital healthcare sector. So really trying to be at the forefront of what is changing now. So that was the aim of our exercise. So we've got 3 objectives as part of this skills need forecasting study. So we want to know what are the main social, economic and technological trends in the health sector, and what's their impact in terms of organizational and individual capabilities. We want to know what are the key health sector trends and what qualifications and skills will be needed in future. And our third aspect is how should we think about an ecosystem of future digital skills needs? So I'll come back to that ecosystem question in a bit. Can we have the next slide, Paulina? So our methodology. As mentioned already, our consortium is 4 countries, universities based in Finland, France, Greece, and Portugal. So this is where our data collection took place. And we collected data in the 4 countries this spring between March and May. And we had 3 methods of data collection. So first, we carried out a desk review. So researchers on the project in each country were asked to do an analysis and a summary of the main trends and recent developments in health, digital, and social fields. Then we carried out focus groups, and some of you here might have been involved in our focus groups. So 60 people overall took part in 15 focus groups across the 4 countries. So we invited experts from digital and health sectors, we invited service users and members of stakeholders and patient associations. And these were mostly in sector-specific focus groups, though that varied a bit. And finally, we conducted individual interviews, 19 altogether, with key experts and stakeholders in the 4 countries. So in the focus groups, we asked people questions around the following areas. We asked about digital healthcare, what they think the main issues are, what competencies are needed, what the trends are. Then we asked them specifically what they expected and what they suggested for our master program. And finally, we carried out an exercise in mapping the digital health ecosystem. And the individual interviews were similar questions, but we asked a bit more about ideas for ongoing stakeholder engagement. Can we have the next slide? So what did we find? So we identified key trends and challenges and opportunities for the digital health sector. And I don't think it's going to be a surprise to anyone here that there's major demographic changes happening across Europe, which are placing strong pressure on health services. So we wanted to focus on the nature of these changes, but also how other trends, including digital innovation, might bring new possibilities and solutions to the problems that we are all experiencing. So this diagram on the left, we've summarized some of the key trends in healthcare and how these might be possibilities for digital change. So staff shortages, burnout, and skills. In all countries, we have noticed, especially since COVID, staff are burning out. We are not managing to recruit enough. People are leaving, going off sick. So one area we think might be lessened by our project is digital solutions that can help the staff shortage and crisis. Second main trend in the digital health sector, there's a trend in all the 4 countries towards dual systems of healthcare. And by this we mean not just public systems of healthcare, but increasing private provision, whether that's by health insurance or by personal payments. And that was in all 4 countries. Another trend we found across the countries is after the COVID pandemic, there's increased technological capacity and acceptance of things like telemedicine in the general population. So people now are far more used to the idea that they can do things through the internet or online or through apps than they were 3 or 4 years ago. Another key trend is the trend in technology towards digital health self-management. So patients are increasingly using self-monitoring tools, apps, to manage their health conditions. So those are some of the key trends that have some digital solutions possibly. Gaps and challenges for the transformation of digital healthcare that were located by our participants are on the right here. And again, they include some things that may seem obvious and some things that may not be quite as obvious. So digital accessibility and equality. So how are we going to make sure that no one is left behind? Digital Europe, they talk about 100% of the population should be able to access digital change. So how can digital health transformation actually support absolutely everyone? And obviously, really, in the health sector, the most vulnerable people are the ones most likely to use the health service. So we can't just assume that people have got technological skills or should have. Second key challenge is sustainability, back to that green aspect of the Digital Health Europe. How are these technological solutions going to be sustainable? How is that the pace of change going to be compatible with environmental concerns? Third issue is budget constraints across all the 4 countries. Health budgets have been increasing proportions of national GDP and more is needed. So how do we manage that? Another issue that the centrality of the patient voice, in a sense, all the health services talk about the centrality of the patient voice, but feedback from our study was that it's often missing in practice. It's talked about more than actually included, and that was quite a strong message from our focus groups. Another key challenge is the need for interoperability across national borders. So not just within country systems, but increasingly we're trying to develop cross-European systems. And related to that, there's data security concerns really high around patient data, patient confidentiality, how these huge databases and systems can actually comply with patient needs in a safe way. Okay. So Carmo already showed our Venn diagram of the 3 components of the program. So we've got 3 main areas we're thinking about: digital skills, social skills, and health skills. So we asked our focus group participants about what skills they thought were needed in these 3 areas, what gaps they saw in new graduates in their professions, what they could see was an issue or maybe a future issue in their own specialist lines of work. So we got a long list of needs, and we've just summarized some of them here. So, and in all of them, people are thinking about skills needed, digital skills for the health sector and for the digital sector, social skills across the board, health sector needs for both healthcare workers and digital people supporting the healthcare system. So it was a bit of a mixture in here. So we can see that digital literacy for health professionals is one of the key things, that many healthcare professionals, say nurses or psychotherapists, are not necessarily up with IT, even less than the average graduate maybe. They've been having very practical trainings. So even things like email and Microsoft Office may be a little bit unusual for some of our healthcare professionals. So we've got to think at one level at increasing digital literacy for the health professionals, And then we're trying to think about skills needed for the IT professionals in interoperability and data security, advanced digital skills like continuous modeling, and then the interaction. So how to draft technical specification in a user-friendly way. So that's the digital skills, a lot of digital skills. You can read more about those in our report. Social skills were seen by participants as really important across the board. And there was seen a need for graduates to have better communication skills, really good change management skills, team working skills, and international cooperation skills. Then over in the health sector, there was quite a lot of knowledge-based skills and competencies needed. So knowledge of different types of health systems, including public and private systems, business and marketing skills, knowledge about both national and international regulatory bodies. So this idea of international regulation was coming in quite strongly in our focus groups, that generally people have been learning about their professions in their disciplinary, but also their national silos. And this is something we need to be moving on from. And another key thing that came out in the health sector skills is how to use and represent data science to patients. So these healthcare professionals, not only do they need to learn these data skills, they need to be able to represent and support patients with using these systems. Then in the middle of our Venn diagram, we can see a variety of overlapping skills that are seen as really crucial to future professions, but also overlapping between the different sectors. So things like developing accessible digital health technology was seen as needing social and digital and healthcare skills. Understanding the ethics of technology and AI was seen as needing health input as well as digital input. Understanding sustainability needs around technological change was seen as a social thing, not just a digital thing. So we'll move on from there because it's quite a dense diagram. Okay, thanks, Paulina. So those skills, you can read more about those skills in the report. And what I'm moving on to now is our health ecosystem. So I don't know if this is a new concept to some of you. It was a bit of a new concept to me at the beginning of the year. So what we're doing is trying to use this concept of the ecosystem at the center of our program. And we're using it as a way of thinking about co-creation within an ecosystem framework, how to tackle complex healthcare problems within a wider system in society and internationally. So what we did, we presented participants with an ecosystem diagram, not the one here, but a simpler version of it, based on the ECH Alliance Digital Health Ecosystem Map. And then we asked participants what they thought about it, what made sense and what was missing, and how they understood their own digital health ecosystems in their own sectors and in their own countries. So at the center of this ecosystem are supposed to be patients, citizens, and consumers. And then the 6 main categories around it. It's health and social care, companies, policymakers, education and research, funders, and the third sector. And the ring outside that is the original ecosystem categories that we presented to participants. And the outer section, the outer ring, is some of the categories that our participants thought were missing or underspecified in the original diagram. So we had a lot of interesting debate around this. And what came out really was some of the missing categories that this ecosystem diagram, even though it's trying to be interactive, covering all sorts of bases, still didn't really cover everything that people saw as relevant to digital healthcare. And some of the key missing actors were international organizations didn't seem to be in the original diagram, so things like the World Health Organization or European regulatory bodies. Patient groups were seen as underrepresented. The idea of business innovation was argued not to be there strongly enough. And also there was a category of everyday life that people thought was missing. And by this, people meant school, childcare, social care, voluntary communities, the sort of everyday toing and froing in which digital health actually may take place. So now we're moving on to what people suggested for our master's program. And Carmo's already talked about our master's program to some extent. And we had an original diagram we showed people, and we revised it from the focus groups and interviews. And on the right of this slide, we can see our final master's program, as it were. We've got our three sectors, health, social, and digital. And we've got courses in each of the three. So you can read more about that on our website, but our participants thought that there were maybe some aspects of this master's program we should be selling more strongly. And I think Carmo's already mentioned some of these, but there really are some quite unique features we feel of our new program. And one is that students come together in this program from both IT and health and social backgrounds. So it's very much an interdisciplinary master's. All students have to cover all these three areas. A second unique feature is that students learn throughout in international multidisciplinary classes and groups. So they sign up as one joint program, all their classes are multidisciplinary international. A third unique thing is it's not just for the 4 countries or for the 4 universities involved. Students from across the whole EU can sign up and participate in the online learning structure with some in-person summer schools and placements. So it's open to every EU student who's qualified to take part and passes the process. Another unique thing about it, we feel it's quite innovative digipedagogic learning strategy, and we've got a whole work package working on this. But there's a big focus on applied learning, industry placements, and real-world research. And I think our skills need forecasting feeds into that from the start, we're trying to learn from industry and real-world people, not just developing an academic master's. Another key thing is that teachers are being trained at the moment. This is ongoing at the moment. And they're collaborating in cross-national teams to try and develop and deliver the courses. So each of the courses will have a teacher from each of the 4 countries as a minimum. And I think there's another one we didn't put in here that maybe we should, that actually, as well as our university teachers, we've got a requirement of the project that 30% of sessions or courses are supposed to be delivered by industry and business partners. So this is something we're working on just this month, how to think about how the industry and business partners are fully part of this program from the start. And my last slide is about our recommendations, and we've got quite a long list of recommendations in the full report. We worked quite hard on various ways that our research could actually have some implications. So here we've put them into 5 broad categories. So we're making recommendations for digital solutions, and they're about quite a lot of things about data security and how this should cross technology, ethics, and national and international regulations. We suggest that interoperability needs to be developed internationally in line with EU regulations rather than national. So again, we're thinking internationally at all stages, really. Then we've got some suggestions for digital accessibility. So we argue that technology developers and social partners need to collaborate to ensure everyone's got the skills to use this technology. But specifically, we think work needs to be done with minority communities at the point of development to ensure that materials, technology, and communications are acceptable, understood, and appropriate. For training and education, we've got 2 main recommendations. We suggest, one, that new training programs are urgently needed, and this is where we obviously are working a new training program to address these skill shortages. But also we argue that multidisciplinary knowledge, skills, and competencies need to be included in all training. So people in one sector training also need to know more about these cross-sector things for digital transformation. Then we've got some suggestions for digital healthcare solutions in practice about lessening the digital divide. And we suggest we should provide health and social care staff with ongoing training and support so that they can use new technology, but also support patients. And finally, we've got suggestions about digital change within the wider ecosystem. So we argue that patient groups and service users should be more strongly involved at all stages of development. And we argue that digital change should be stress tested in advance, audited and evaluated for accessibility and for sustainability. So that's back to the idea of digital transformation coming in a more human-centered, transparent and ethical way. So that's basically our findings. So back to Henrique.
Well, thank you very much. We have 3 minutes for discussion, maybe 5. Anyway, we have a question already from our audience, but feel free, everyone, if you still have 1 or 2 more questions, just type them in the Q&A. I'm sure Janet will be super fast at addressing them. So over to you with the first one, and I'll read it to you. Then I also have one prepared for you, but I want our audience to feel they have the space to do that, because I can always email you my question. But anyway, the question we got is quite interesting, actually. It's basically says it's surprising not to hear anything about the active resistance of several players in the ecosystem. Powerful players in health care have very good reasons to defend the status quo and resist changes related to digital healthcare. So I think the question, I mean, of course, the master is not about this, but I guess from this question, I would rephrase it to ask you whether you are considering within possibly in the social skills, sort of championing skills. So I guess what I take from this comment is that perhaps it's not just about the skills, it's also about still we need some drivers and leaders in digital transformation out of these students. So did you find this need? Do you think the master can also prepare them for this?
That's a really interesting question, because no, we didn't encounter any resistance. But when you first said about resistance, I was thinking about actual patients resisting. So there's also resistance from the population, people who don't want their data to be uploaded onto big systems, people who resist sharing of their data, and so on. So no, we didn't really get that in our methodology. And I suspect that's because we invited people to take part, and only people who were feeling quite positive towards us took part. So that's a really interesting gap that would be interesting to study further. And certainly I think we'll look into that a bit. As a social psychologist, that sort of thing interests me quite a lot. So no, we didn't in our study get much resistance, but that's obviously something to notice.
Yeah, thank you. Now, still have 1 minute. I was wondering, I mean, Oscar, go ahead. You raise your hand, so over to you. May have a question or comment. Over to you.
If I may, just, because it's to prepare the workers for the digital transition and to make sure that they are, because, healthcare and digital now, they go together. And you are talking about this resistance. Have you already managed to identify what are the main reasons for this resistance? I mean, in terms of, change to digitization, it's the same resistance everywhere in the markets, in the countries that you are target, or for instance, in Portugal, it's not the same like in Finland. And if you can put an example of this resistance. Thank you.
Oscar, I think, well, the question didn't go into those details, but I guess from my own personal experience working in Portugal and now with other countries, I think what the person talking about this was talking is the resistance of non-digital healthcare providers. So providers of healthcare that traditionally organize services with less digital or even non-digital solutions, how they resist digital transformation. And the best example I know, and this happens in different countries in the EU, is opposition to telehealth. So we see in different countries that traditional players, hospitals and some sort of private providers, often lobby through medical associations and other associations that the law is more restrictive than it could be otherwise on for example, telehealth. I think this is the topic. But I guess we have to move over to our next session. So Janet, thank you very much. Before I prepare everyone, you will see a pop-up pool that will be available for the 5 minutes break. So during this time, please fill in these questions that you will see in front of you as I speak right now. And this is gathering information for our project and for the discussions ahead. Thank you, Janet. A wonderful job, wonderfully presented. Thank you so much for this, and it's been very exciting. Thank you.
Thank you.
Okay, let me say that we will come back in a few minutes, so don't I mean, take the time to stretch your legs. But in terms of program, we would be restarting in about 3 to 4 minutes. So just stay tuned with your computer on, so that you hear us when we're back from the break. And again, take the opportunity to fill in the pool. Thank you so much.
Hello, good afternoon. I would just like to have some feedback to see if everyone is seeing me and hearing me well.
Yes.
Oh, thank you very much. Thank you very much. So, first of all, my name is Fernando Reino da Costa. I'm the president and CEO of UniPartner. And in brief, UniPartner is a consulting and system integrator. We work with the public and the private sector and organizations, and on all sectors, from banking sector to the health sector to the public administration. And to give you an example of something that we do, we recently have been supporting the Portuguese health sector exactly in this challenge of upskilling its workforce for some, you can say, office and basic skills in order for them to work with the new cloud technologies that everyone had to use when the pandemic started. So it's a pleasure. And first, let me thank the organization to invite me to moderate this panel discussion about the impact of AI. And regarding the AI, we have been saying for a long time that AI is a very impactful trend. We've been talking about it for the last years, 3, 4, 5 years. It's growing and growing, but in the last 4 or 5 years, we've been talking about AI as the right next trend. But last November, last year, with the public launch of ChatGPT, I believe a lot has changed. Everyone could see what is available, the capability, the potential of AI, namely the LLM capability and technology. And I think today, the public sense about AI is that, and that what everyone thinks is that clearly it will reshape the world in the very near future, and starting with some professions that will need to change very strongly. But as we know, and we are talking on in the health sector, applying it in the critical context, it's a different challenge. So there are major challenges here, and the maturity of the technology, the content, privacy, security, etc., is in the end what we would like to have a discussion today. So for that, it's a pleasure for me to moderate this panel, and also to learn from its members, because the members of this panel, this panel is formed of a group of professors, renewed professors with recognized experience and knowledge that are currently working on this field. So let me go through them first, and let me go through their bios, because it's quite important for all of you to understand what each of one and from different regions are doing right now and their experience. So first, Professor ManagiDiTH, thank you for being here with us. Professor ManagiDiTH works at the University of Thessaloniki, and he specializes in medical physics, informatics, and medical education. He designs innovative technologies to improve the lives of elderly and vulnerable groups, and enhance healthcare education. Professor Babinis leads multiple European projects holds a leadership role in professional societies and has received a number of awards for his research and academic achievements. He also established initiatives like the LLM care ecosystem in the Salonic Action for the Health, Well-being, and Living Lab currently. He heads the Medical Education Innovation Research Unit at the School of Medicine. So thank you, Professor, for being here. Professor Ricardo Correa. Professor Ricardo is Associate Professor at the Department of Community Medicine, Information and Decision Sciences. The Faculty of Medicine of Universidade of Porto. He has collaborated on implementation of several health information systems, member of several organizations of health informatics standardization, currently president of the Portuguese Health Informatics Association, EMAIS. He's currently supervising several PhDs and masters, these on health informatics, and co-founder of 3 startups and spin-off companies and a professional school. He has recently been involved in several seminars presenting the potential and the dangers of using LLMs like ChatGPT that I mentioned in higher education and on healthcare, of course, standing out as an informed and critical advocate of emerging technologies in the healthcare. Thank you, Professor Correa. Kaija Saranto. Dr. Kaija Saranto acts as a professor emerita in the Health and Human Service Information University of Eastern Finland. She serves as a program director for Master, first IMIA accredited, and a doctor degree program in HHSI from the very beginning. Her research focuses on health data analytics, shared decision-making and virtual care, as well as patient safety in cooperation with national and international colleagues. She is an elected fellow of the American College of Medical Informatics and an American Academy of Nursing, and an honorary member of the IMIA Nursing Informatics. And Finnish Nurses Association, as well the Finnish Social and Health Informatics Association. Currently, she acts as the president of an inaugural fellow of the International Academy for Health Sciences Informatics and the chair of the education group of the European Federation of Medical Informatics. Last but not least, Adrien Hugon, professor of the Université of Gustave Eiffel, an engineer school that belongs, he works at ESIEE in Paris. It's an engineering school that belongs to the Gustave Eiffel University, and he teaches computer science applied to healthcare domain. He's a co-responsible for the biotechnologies and e-health branch. He's also attached and researcher to the LIP6, a research laboratory in the computer science that belongs to the Sorbonne University and the CNRS. His area of expertise is the participative conception and symbolic artificial intelligence solution healthcare. So thank you very much to all of you to being here to share your knowledge with us, and to start this discussion. I will start here with a question to Ricardo, to Professor Ricardo and Professor ManagiDiTH. There are a lot of trends here in AI, as we know, globally, and we, in the common sense, we discussed this a lot. But regarding the healthcare, what do you see as the main trends? What will impact as the main trends of AI as we see it today. Professor ManagiDiTH, if you may start,
Sure.
please.
Thank you very much for the introduction. First of all, I hope you hear and see me well.
Thank you.
Okay, so if we consider the trends of AI in healthcare, I would like to make a distinction between the usual sort of AI systems. I can dare call them traditional versus the more contemporary ones, which belong to the more generative AI, which we are used in the last year or so, like the ChatGPT ones, and this kind of this generation of I would say tools. Now, I would like to split these trends in three domains of healthcare, which I believe is the whole thing: in clinical practice, in research, and in education, healthcare education. Now, I think we all agree that none of these sectors is going to be completely free of the interactions of systems that incorporate AI and intelligence. They have already started being affected in the last few years, but we are going to see an explosion of such trends in the next few years. With regards to clinical practice, I think that there is a trade-off between the routine practice and the very specialized practice. Systems with AI capacities have been probably utilized in very specialized cases where the need for being assisted in a very specialized way may be powered by an AI system. But to be honest, the routine clinical practice, the routine healthcare services, I don't think that they have seen any huge, I would say, effect of AI applications so far, and that's I think the challenge of the contemporary AI systems, like the generative models like ChatGPT and the similar kind of tools. If they will prove being of assistance in routine clinical practice or in usual everyday healthcare services, rather than very specialized assistance to, rare diseases or surgeons or oncology specific cases, etc., etc. Going to research, which is the second domain that I could see a lot of applications and a lot of explosions, I would say. We have seen the speed effect that is mattering. It matters a lot when it comes to AI applications. Systems that incorporated AI capacities were usually slow and therefore would not be of any usage in real time, which is needed in research and in applications in healthcare, but were not also very effective in the sense that many of those systems were having low achievements in terms of how much were, replying to the problems. It is here that the speed and effectiveness are now tackled very well with the new trends in AI. And I think we are going to see an explosion in many, many different domains in healthcare, analytics, anything you name it, you have it. I can go on later on, perhaps, with specific domains in this one. The third one, which I will try to give a sample of what's going to happen in AI, is education. Traditionally speaking, AI in education has been a complete failure in the past 3 decades, I would say. It's been in the last only 10 years that we had vibed our hopes and expectations from these ones. But now, with the contemporary models of AI and generative AI, I think this is now going to be exploded. We have seen already a lot of differences because many of the young students are using these tools, and we need to change the way we teach, the way we assess, and the way we detect plagiarism, for example. But not only this is going beyond education and goes into healthcare professional practice and training, which is also affected. Just one small example to signal what I'm saying is that we have seen, for example, the test of ChatGPT on passing the exams for becoming a professional in a specific specialized sort of domain in medicine. And we have seen how, as a matter of time, ChatGPT has been able to reply and pass all these tests. And therefore, there is a problem that is being created on what kind of knowledge you expect from specialists if tools like and bots like this can actually be effective and efficient. So we need to rethink how we educate. We need to rethink how we assess in education altogether in all levels, undergraduate, postgraduate, and professional continuing education training and stuff like that. Because of these tools. But the message is let's do the best and let's incorporate into our practice what can be incorporated with safety. I will stop here and perhaps...
Thank you very much.
Thank you.
Thank you very much. Professor Ricardo, your thoughts about the trends here in the in AI in the healthcare?
Sure. Fernando, first of all, I think this is a very tricky question because it's very hard, I would say today, to try to guess how these tools will evolve in the next couple of years. That's
completely agree with you. I won't bet on it. I won't bet on it.
Yeah.
I won't put money on it.
So I would say that one thing for sure is that it's very hard for no what's going to be the near future. And I'm not talking about the future in 20 years or something like that. And I would like to actually use some of the things that my colleague Panagiotis has just said and try to use the same classification, I would say, just to add some notes on top of it. First of all, I think that we need to understand that typically we say the elephant is in the room. So it's not really something like we should be considering on how to control things like ChatGPT or another LLMs that are appearing, because they are already out there. And so and this, for people that are used to reading things about this, well, we know that this is available, but I still see a lot of my professors, my colleagues, asking how can they control how the students use it. Well, you can't. And I think that, in my opinion, it's something that we need to be aware of and understand that the new world is like this. I just saw yesterday, there is a list of existing LLMs that are being worked on. And today we have 178 LLMs. ChatGPT 3 is one of them, 4 is another one, but there are another 175 or 6. So it's really a widespread thing. Another thing that I think it's important for us to know is that citizens are already using it and are already using it to ask things about health, which is frightening, but it's the reality. I'm not really, I don't think that the solution is for us to try to convince everybody not to use it. Well, we can try, but I'm not really sure if it's going to be very successful. But we need to think about ways to make it a safe usage of these tools. Another thing is that, and so I think, in my opinion, we will have like a new solution that will be better than Dr. Google. That's how I see it. Okay. Now, health professionals are already using it also in a different way. But when I talk with colleagues of mine and former students of mine, they are using it, and they are using it to make questions that sometimes they are a little bit afraid to say what they are asking, but they are using it because it's so easy to, and if I have a doubt, it's easy to ask it. And that's one of the characteristics of these ChatGPT-like systems, that it's really a game changer. It's much easier for us to use it, and that's why it really got this huge number of people using it. So I think that probably we'll have new, much better solutions than systems like UpToDate that health professionals are using. Well, it's easy for us to imagine a new wave of solutions like this, much easier to use, that can somehow read between the lines on what the health professionals say, understand better what they want. So I would say that would be one of the trends regarding health professionals. And then for two other groups, regarding students, I've been making a lot of seminars on using ChatGPT on health schools. And one typical question that I make to the students and professors, it's what's the percentage of students that already have used it to deliver essays, and the percentage of professors that have used it in their own tasks, and the percentage of students, it's much bigger than the one of professors. So this is, if you're thinking about asking for a student to make an essay, you should think that they are all going to use something like this. And if you think that you are going to convince students not to use it, well, it's I would say optimistic. So when you are evaluating, consider that. In my opinion, that's the best way. I can tell that to my students what I say. I will say they'll have a lesser grade if they don't use it. So I assume that everybody should use it, and if they don't know how to use it, then come to me, and then of course I want them to say how they have used, what were the questions, what were the answers, how they interpret the answers. But I'm not assuming that they are not using. And then the last part is for companies. I've made a very small questionnaire to some of Portuguese startup companies on health IT, and most of them are trying to incorporate services on their own products. And so that's another thing that I would say that in the next years, we'll see a lot of products getting better, but they are actually incorporating AI that come from these LLMs and other solutions. So I would end up by saying that for me, human creativity is the limit, but maybe not even human creativity, because I don't know if you already asked ChatGPT to try to create new things and to suggest new things, and he also has some ideas on it. So maybe not even, Fernando, human creativity will be the limit in the future.
Thank you. Yes.
I'm not trying to be very optimistic, but all of these things are things that I'm seeing on a weekly basis. So I can give more examples on it if the discussion leads you to that.
Well, this is a fantastic discussion, because clearly it can go to different topics related to the same challenge of the LLMs. But going further to the next question. The service in the healthcare. We talk a bit, or you talk a bit about the services in the healthcare and how they will be impacted in a certain way. But let me pick two things. Well, first was what Professor ManagiDiTH said, that in the clinical practice, he sees that the usage of LLMs it's low and probably will not accelerate so quickly. But in the end, Professor Ricardo did state it again, that students are using it. So, but then students are going to the market some years now and are going to be doctors in the field. So probably in the near future, we will go to a doctor, a young one, and he is using ChatGPT in the middle of the conversation with this patient. So this is probably one of the service areas, the way the healthcare services are impacted in the near future, but probably there are several other well, impacts or ways of the services, the healthcare services that, like we know them today, that will change. So, well, for that, I will ask here Professor Kayaja and also Professor ManagiDiTH to give us some thoughts about this. Well, so the health services, how will they will be impacted, how they will change in a certain way because of what we are seeing right now in terms of AI.
Sure, I think you are pointing it at a very crucial point of discussion. I think for ages, the problem with healthcare and the way computers, as you know, inverted commas, are going to be utilized, were going to be utilized. The problem was the digitization problem. Nobody wanted to enter those manual details in records, in registries, and stuff like that. The doctors were not, you know, wanting basically to deal with this prospect. The nurses were afraid of using computers and all these kinds of problems. So there are too many countries around the globe without any digitization at all in the systems, or some digitization, and not sufficient digitization to allow AI systems to be applied in an unbiased way. Now, here is the trick now, because a few months ago in Chicago, the ChatGPT 4 model was utilized and modeled basically how a healthcare clinician could actually use new platforms and turn a patient interaction into clinical notes in very, you know, rapidly, basically in a few seconds. So a clinician records the patient visit, you know, using the AI platform, and the platform adds all the details in real time, identifies gaps, prompting the clinician to fill them. So effectively turning dictation into a structured note that, you know, and the problem is all solved. And then following up, you know, a lot of other inputs can be done in electronic health records, etc., etc. This is a tremendous revolution in healthcare practice. And I think the impact of that is going to be very widely applied, and we're going to see it very quickly in all healthcare domains in that sense. But if I wanted to sort of highlight specific other domains that are important, and we are already seeing some differences of how AI is impacting, I cannot avoid mentioning, for example, medical imaging. I cannot avoid mentioning drug discovery. We have seen it in vaccination discovery. And I think a lot of disease management stuff, including telemedicine, including remote monitoring, are going to be affected in the way we are going to be using AI models and AI systems. Of course, personalized medicine, as it is called, I think has already been impacted, like genomics and bioinformatics. These kinds of domains have already been impacted by the application of deep learning per se, because a lot of things can be done not only automatically, but I would say effectively nowadays, if large pools of data are available, digital data are available, and good quality data are available. But the other problem that we are going to see is obviously we are always going to be confronted with regulatory and ethical frameworks and changes that need to be implemented there, or new regulations that are going to be in effect when the systems like this are going to be, for example, applied in administration for healthcare, or in automation or in other domains. But one of the, and I'm going to finish with this one, one of the domains that we have seen probably some 15 years ago, AI being probably feasibly and powerful to provide some support was mental health and public health. I think one of the first systems that I was confronted probably in the 2000s was the capacity of systems like avatars and with intelligence and affective computing applications to empower dialogues of psychiatric patients with their consultants and clinicians. And I think this is now becoming the era of automation, and we are going to see a lot of systems, especially in the generation that is going to be using these tools very effectively. Therefore, one sector of the society is going to be impacted in terms of public health by such applications. And I think, generally speaking, every single aspect of healthcare is going to be affected one way or another, sooner or later. But these last couple of points, I think we're going to see tremendous differences, so to say. Thank you.
Thank you very much, Professor. Professor Kayanja, I would like to have your thoughts on this, on the health service impact. And let me add a sub question, if I may. With AI, do you think also that we can reach more people? We can escalate the health services also, because sometimes we talk about more the fact that we can do better healthcare services because we can have intelligence to support all the knowledge that is around, that is needed to a specific answer. But also this digital capability also gives us the possibility to scale. Professor Kayanja, your thoughts here about the impact, please. Professor, I'm sorry, Professor Kayanja Saranto is here with us.
Yes, she is, but we cannot hear her. Sorry, Kaya. We can see you, Kaya, but we cannot hear you.
Can you hear me now?
Oh, yeah. Yes, Professor. Thank you very much. I'm sorry.
So thank you for your kind presentation and introduction, and I'm happy to give some insights from the perspective of service providers. And IE is already in use, but has a great potential, I think, in administrative tasks also. For instance, we may call it also, in a way, healthcare automation, and especially appointment scheduling, record keeping, as was mentioned already, billing. All these time-consuming tasks can be automated using, by, for instance, chatbots and different kind of software, and free up professionals to focus on patient care. I think this movement is on way, but not far to be beneficial. And also mention about patient engagement, and that involves also patient education, can be strengthened through chatbots and virtual assistants, which provide information, reminders, and support to patients in managing their health, for instance, medication or post-treatment recovery. So this is like a joint effort with patient and professionals. Also, I think briefly was mentioned privacy protection and data security, which can be enhanced through threat detection and encryption to protect sensitive healthcare information. And I think more effective treatment and reviews of adverse effects has been created by analyzing patient data, like genetics, medical history, lifestyle factors, and recommend personalized treatment plans, which also was already mentioned by Dr. Pamidis. I think this personalized treatment plans has a potential also to affect like workforce issues. So I think that we have already benefit from AI in many ways, but all these possibilities depend also from cultural issues. For instance, strategies. In Finland, we have had for 30 years e-health or digital strategy, and I think that is a key issue to give these ideas further and into practice. We all know also in EU level we have a lot of regulations, and I think also national regulations, they may seem to postpone things, but I think at the end, if we more standardize ways of implementing IE, I think it will benefit everyone. And last but not least, there is always the competency issues, like also mentioned. Again, in Finland, we have had education for using different kind of tools for 30 years, and I think it's attached to the IT strategy, which also affected education plans and also education programs, which should have or were able to benefit a little more, like different kind of IT solutions also. We used to have even electronic health records at schools, in medicine and in nursing, but I think that is history because they are so expensive, and the implementation of these EHRs is so demanding in terms of having personnel, also extra personnel. So I think the skills our professionals achieve is done in practice. I also had some ideas about patient care, and I think what we didn't mention was the area of evidence-based practice. And at the moment, we are here in Finland implementing some evidence-based recommendation and alerts into EHRs. And I think that is also something which provides more high-quality care and also safety, and in a way also helps professionals to work more efficiently. So these are my thoughts at the moment.
Thank you very much, Professor. One of the, we talk about several topics, very important topics, and one of them that is clearly another big discussion, it's in terms of regulation or the lack of it in terms of European community. And the lack of it because in some areas we have a lot of information that is not regulated, like Professor Ricardo told, we have Dr. Google. But if you want to have a assistant, a AI assistant with a strong language model technology, and we want to create a product to put it in the healthcare system, you need to go through a certification, a huge complex certification process that probably no technology partner will handle or want to handle, and then you have free content available that is based on advertising model, because in the end the way they want money is based on advertisement. So the economy in the middle of the regulation, it's a complex issue, and it's for me it's another discussion, clearly another discussion, but it's a very important one, because if you want to have LLM good healthcare services with LLM, where we need also to tackle good content in the end, and content that can be put to the healthcare system, available to the citizens and also to the professionals. So going further in our conversation, well, the big question is this the big revolution? Is this AI what is changing going to change clearly the healthcare professional patients? What is it or is not? Professor Adriano, what are your thoughts about this? we are in the middle of a storm in terms of AI. Everybody talks about it in all the areas.
That's very, yeah.
But it
That's
is.
very, sorry.
So, sorry, but here in the healthcare system and all the sector in professional patients and all the technology partners in the middle, what do you see in terms of it, please?
Yes, that's very true what you say. So thank you for giving me the opportunity and the chance to be part of the discussion. And thank you for the very good introduction to the panel. That's a very good question because, as you say, if you look to everything and you hear to everywhere, we think and we have the impression that this is a very big technology and a very actual revolution that is happening right now. In my opinion, this is not the case for different reasons. And the first reasons for which this is not the revolution right now is because all the solutions that integrate artificial intelligence are not with the sufficient performance to be used in the clinical use. What the health professional expects from the solutions that they have to use to deal with the patients is that they are with excellent performance. And this is not the case right now for most of these solutions that are based with artificial intelligence. Of course, there are research projects, and it's very interesting to follow them. It's very interesting to see some of them that are producing some results in medical imaging, in producing new drugs, in analyzing the medical records, and so on. So that's very interesting. And it might be the very next revolution. For the moment, in my opinion, if we see what's the revolution for the health professionals, I would say that the digitalization of the information systems has been a revolution, because going from the paper to computers has been a revolution to work with the patients. Regarding the patients, I would say that it's different. Their revolution is when the healthcare services are being proposed out of the healthcare centers, out of the hospital, with the use of wired services, and to be able to self-monitoring because they get power on themselves for the health. And I think that for the patients, this was their revolution. That's my thought.
Okay, so in your opinion, we are still a step behind in a way that we need to accelerate the digital transformation in some basics in the healthcare sector, and there are other technologies probably that will impact more in the near future.
Yeah, we need one more step so that these all these projects have the right performance to be used in clinical use, because otherwise they won't be accepted by the health professionals. And I'm not sure that as patients, we would accept to have some solutions that are not perfectly sure. I mean, not secure, but sure of the result, of the prediction.
Okay, okay. And Professor Saranto, do you agree with this opinion? It's a different opinion in a certain way of how it impact and accelerate on the healthcare sector.
I think that it in a way it isn't the biggest one in my mind, because I think that when technology involves, there is always some big issues. But in terms of healthcare, it is quite big actually, because it will change a lot of our ways of providing care. But I think that there are a lot of challenges, as well as said, which will hold the revolution. For instance, when we integrate AI to different kind of healthcare information systems or infrastructure, it may be really very challenging, and it anyway will be very expensive. And the adoption of AI technology may vary among healthcare organizations, which is in one country always a problem. And again, in terms of the regulations, I think navigating these regulations can be complex in for AI developers and healthcare professionals. And I think in terms of having these AI acts already we have in our union, European Union, I think it has proved that it takes really time to get them into places. But I think that also, if we think from patient perspectives or healthcare providers' perspectives, there is also some socio-economic things and geographic locations which may have significant challenges, who can afford or which part of the country has really the possibilities to take that in place. And I think that somehow it needs to be thought in one country. And I think we mentioned briefly about these ethical issues, and I think these must be in place all the time when we speak about the implementation of these huge revolutions, because it may also cause some problems and bias in, for instance, creating algorithms. The data quality is really important. And as a patient safety researcher, I also must emphasize data privacy and security issues, because this is the very important and sensitive data we are quite often talking about. So this is my thoughts.
Very challenging times, clearly. And what I see is that, this digital innovation and the AI innovation, it's clearly a moving target. So to go to my last question, I see that this moving target and also the fact that we have a health system that is working clearly in different speeds, because there are areas where we need a certain kind of basic digital technology to digitalize process, or there are other areas in research where we are using the best that is available to research for a new disease, a solution for a new disease. Based on this, going to the last question, the challenge is what should be taught? What should we teach to new professionals and professionals that connect these three main areas that are in the basis of our event: the digital, the social, and the health professionals. All these three. What in your thoughts? What will be taught today or in the near future? Because this is a moving target, so we're not. It's difficult. We are not probably teaching a specific technology, because 1 year or 2 years from now, probably we'll talk about a new thing. So going back to Professor Adriano and Adrian and Professor Ricardo, what do you think about this? What should be thought what skills do we need in order to prepare the future in a certain way? Professor Adrian.
Yes, you want me to start? Okay.
Please.
That's a very good question too. I think the answer is not the same if we consider the students with, I would say, technical background in the IT domain, because those are the ones who will design and work on the conception and the development of the next solutions. So they need, of course, to be taught about how to build the methods. But I think that more specifically, because we're in the healthcare domain, they need to be taught about what is a healthcare data. And I want to take some examples about that. Let's consider this example about how to know that somebody has hypertension. And this information comes from the electronic health record. And we can have this information in different ways. First, because we have the information written or coded in the information health system. But it could be in another way. For example, there could be some treatment or drugs against hypertension. Maybe it's not written that the patient suffers from hypertension, but because he has some drugs and treatments against hypertension, we know that the patient has hypertension. We now also have the information because we have the measures of the blood pressure. And regarding these measures, we know we have the information. And lastly, we might have the information because there are some letters and documents written by other health professionals saying that this patient has hypertension. And it shows by this example that if someone who is working on the health data and just ignore this can misunderstand the data and make some wrong processing on them. So that's very important to me to point out that for the data scientists, I mean, they need to be taught about what is health data, not only the data scientists, but with my example, we understand that those need to be taught about that. Let's consider now the point of view of healthcare professionals. And they are the users, they don't know, they don't need to have information on how the solutions work. They need to know the principles of these methods. They need to understand how to interact with them. And once again, with an example, they need to have some information about why sometimes artificial intelligence solutions may predict errors. This is something that is very important because this is very about trust to the solutions. If this is very frightening, in fact, if you go to the hospital and you say this product may predict some errors, and the health professional usually will say, okay, I won't use this. And this is also about the question about resistance that we had before. And this is why we need to explain this. And the answer, to be just a little bit technical, is very clear. If you have the technical reasons, it's because using such a solution, you work on the solution using data. And if the performance, the prediction is too good, we call that overfitting. And the data scientist, any data scientist will say, if there is overfitting, this is not a good solution. If my product predicts 100% of the data, of the results that are expected, it's not a good solution. I don't trust that solution. And with that example, we see that we also need to put all those students together, those with IT background and these with health background, I would say, to work together on the solutions. Those with the health background will explain what is the health data, what is working in the healthcare domain to the IT background students. And the other ones, in the other direction, the IT students will explain why sometimes it does not work perfectly, and it's not a good thing to have 100% of prediction if you work with AI-based solutions.
Professor, that's again another big issue because
that's very good.
ChatGPT. One thing that we need to understand right now, it's not. It's like a human. He can make error, and this is something that we don't understand in the way that is a machine. So we want a very straightforward answer. So for you, so in terms of what should be thought, what we need to, what kind of skills we need to give. It's not the technical part of it, of course, but it's understanding the technology, the potential of it, and try to demystify certain aspects of it in order to use it in a better way.
Exactly.
Professor Ricardo, your thoughts about this?
Well, I completely agree with Adrian, and I want to stress also again the importance of health professionals and citizens in general to understand the importance of good data. All of this is based on data, and I think that many times we don't realize the importance of such things. So that's one thing. Now, for students, I would say, and for the teaching process, I think that we need to learn. So the professors need to learn how to use these solutions to make students think in a different way. So I think that for me as a professor, my main goal for the next years will try to make my students make better questions to ChatGPT-like solutions. So not really concerned on the answers. Of course, they are important that ChatGPT gives, but for me, the process of making students make the right questions and in a dialogue, that it's interesting. And I think it's important for them to take advantage of these solutions. And I think that this is going to open really something that has been talked for many years, which is personalized education. And I think that this is going to really make it much easier for the ones that can take advantage of it. So if you are really, as a student, if you are really very interested in something, and if you have a tool that somehow can get your answers very quickly, and you can actually ask, well, your answer is getting a little bit too complex, please make it more simpler for me to understand. So this type of dialogue will really open, in my opinion, many opportunities for students to learn. And we might have in the future students from an health course be interested in electronics and starting to make questions about electronics and see how the two things are related in a language that they can understand. So for me, it's really opens really many opportunities. Of course, today we can have that, but we really have to be very keen on learning, because the solutions that you'll have to read books or pages or web pages or whatever, so it's a little bit harder. With these two solutions, I think it's going to be much easier. And so I think that we are going to have a problem for how we typically teach, is that it's going to be more interesting for students to learn using some of these solutions on a one-to-one basis, I would say, with these solutions. So I think we need to reinvent also the classroom as we typically saw it. And so I think that we should try to think of bringing these solutions into the classroom, take advantage of them inside the classroom, and start thinking that it's not just students and professors. We have also this third entity somehow, and we should try to use it and make it like a teamwork that will also, I think, will be very helpful for professors, because this idea that still exists in many areas, that professor has to know not everything but most of the things, I would say, it's going to be harder and harder for us professors to do it. And so we might have here also an assistant for the subjects that appear, the topics that we want to discuss inside the classroom, in a more teamwork fashion of giving classes, other than on a more traditional professor-student way. So Fernando, it's going to be interesting the next years for everybody, I expect.
If we already know that innovation, digital innovation, AI, it's a moving target, like I was saying. Clearly, it's accelerating. It's accelerating, and changing people, changing ourselves, changing the ones that are in our sector. Is clearly one of the main aspects of it. look, thank you very much for this fantastic discussion. We already ended our time. We have a question here in the Q&A, but it was already answered in the Q&A. But I will briefly tell the question. The question was from José Mita. It was about the question was if the healthcare professional need to learn more about AI in a technical sense, in the algorithms of programming, and the way the answer Dimitris has answered, said in its answer, it in some way depends, but obviously what we have been discussing here is that in general it makes sense for a healthcare professional to understand what AI is capable of and what is giving as a tool, and not entering in detail of this technical part. But he needs to understand and knows the potential in order to support also the evolution of it and to incorporate these technologies in his daily work. So thank you very much for for being here. I learned a lot in this hour about the subject and the impact of it. A lot of topics and subtopics can be discussed, from ethical to privacy and security concerns. We talk about them in brief, but there are clearly a lot of topics to go in detail in further discussions. So let me thank you again. Thank the organization for inviting me to moderate this panel. It was an honor to be with you, and I will pass to Carmo Gomes for the closing remarks. Carmo, thank you very much again.
Thank you so much, Fernando. All the panelists and all the speakers and the participants in this webinar to having had these wonderful and very insightful discussions about what are the future trends in the health sector. I'm aware that we are beyond the schedule, so I'm not going to take much of your time on my closing remarks. I had a couple of notes from all your interesting ideas, and I want just to note 3 of them. The first one is that AI is a reality, and the ones that think that will control it, and I'm thinking, I will speak with these broader terms of AI and not with the technological terms, very specific that you know better as a digital people, but is there, and who would like to control the use of it by the citizens, by the professionals, by the students, by the teachers. I think it's a lost battle, and I think all the panelists and all the opinions around the table have brought the discussion about the challenge, the risks, the many assumptions that are there, but the idea that controlling is a losing battle. I think it's something that it's also very important to understand. What we need to do is to handle it, not to control it, but to handle it. So this will require a different set of skills and a different type of knowledge. The second thing that I would like to stress is that in fact, it might be the case that we will have a better Dr. Google, to quote Ricardo, and that will impact the way that the healthcare services are going to be delivered, and it will be a competitive element to the classic ways of delivering health services and healthcare. But there is also here another battle, I'm quite balanced today, between economy and regulatory frameworks. And I think we as researchers, as people that is working in education and training, we need to be very aware of this, and also the ones that are working on the digital side, that it's a must that ethical principles, regulatory frameworks need to be developed and need to be we need to comply with them. And this is linked to my third topic, that is, I really like the controversial in the discussion about if this is the biggest technological revolution or not. And the way that Adrian said that it's not yet there, because it thinks that we need one more step to have the high performance of these solutions so people will trust. People, and when I say people, all of us, I think it's quite an interesting insight. And I will take it as one of the takeaways of this webinar with me, also to have this critical thinking about what are we discussing right now about these LMMs or solutions or artificial intelligence, to say it more general. I have a last quotation from one very well-known psychiatrist here in Portugal that is also a doctor in medical anthropology. And in one of my readings, one of these days, I came across with this idea of him that the relationship patient-doctor is a world cultural heritage, which I found brilliant. And I thought I wanted to bring this as also a controversial element, because this is a key element of our civilization as humankind. So how far can we go with all these technological developments, and we can still keep some of our key elements of our civilization as humankind? And I want to close this webinar by leaving these words of Professor Júlio Machado Vaz, because I think they need to be reflected also in the way that we are developing such masters that integrate the social skills, the digital skills, and the health skills. Our civilization values, our civilization ethic principles should prevail, and that's also my opinion. So technologies are welcome. We should not try to control it, but we need to regulate them as much as we can. I think we had a very interesting afternoon for us in Lisbon. It's still afternoon. I'm afraid that there are people from other time zones that is quite late at this point of the day. And I would like to thank you for your attention, for your patience. And I want also to say that we are willing to continue this conversation. So we will come back to you. We are going to organize follow-up discussions during our project implementation.